It is the Big Biz Show. We're coming to you live from sunny, beautiful Southern California inside the Loft 100 studios. Wherever you may be at this moment, as always, we appreciate you being along for the ride. I am Costa here, the end of the bar. There's Mary Bert Godwin. There's Greg Todorov, our executive producer, and of course, Sully.
We got Kirk Huntsman. Look who else showed up. Dr. Bahar Esmaili. She is a practicing dentist. She's also the vice president of clinical integration at Vivos. So what you just saw with Mike do, this is an everyday thing for you. This is what you do on a daily.
Pretty much, yeah.
So what I want to know is when you see patients like this, do you know ahead of time when you're looking at somebody saying this guy is breathing through a Starbucks straw? You can tell in a minute.
Really? Oh yeah. It's like there's a nail in their forehead.
It's like what?
It's like there's a nail in their forehead.
Oh, and you're okay. Because I remember the pictures. Do you guys remember pictures of Shaq last time?
Yeah.
Oh yeah.
And Shaq was like, bent like all this, right?
Yeah.
So when you talk about all the other ancillary things that this can do, part of this is it? Would you call it posture? I mean, is that what really?
Yeah.
What else does it change?
Because really, like we were just listening to him saying, airway is really not an organ; it's a hollow space in our body. And when we're standing upright, now we have to make that function. So the way that our body is twisted around like a pretzel around that space to stay open, comprise of how you are holding yourself.
That's a great way to put it. Right. So we are twisting ourselves around
pretzel
to make way for this thing, no matter what we need to do it.
Yeah.
Greg asked you a great question on the break. Ask your question.
Well, I did. You said at one point that there are people who do this for aesthetic purposes only, right?
Yeah.
Because for cosmetic reasons. So as the CEO of the company, do you say, okay, this is another vertical that we didn't necessarily think about, but obviously, given the addressable market for cosmetics, in cosmetic, not that this is surgery, but improvements, let's say.
Oh, it is.
How do you ignore it? You can't ignore it.
We can't ignore it.
No.
Right? It's so popular because it is non-surgical. And so somebody doesn't have to endure the risks of surgery to come out looking better. Right? Yeah. I mean, a lot of times patients will lose weight while they go through treatment.
And you said it's
more symmetrical, stronger jawline.
There's this
right?
big jawline,
9
what
months.
you mentioned.
9
So
months.
that's
9
a big
months to a
thing right
year.
now is the jawline. Yeah.
Well, listen, every time you come on, you show pictures.
Yeah.
And you're showing pictures of people breathing better. It doesn't make any sense. What you're showing is the physiological change.
Yeah.
Exactly. We have a picture right now. I think this is a patient that you brought. Jared, breathe out. Okay, so there's the difference between a before and an after here. And what are we looking at there?
I mean, look at that nose.
Looks like two different guys.
Two different people. And you guys, that's just like
That's
few months.
from the
Do you see the bridge of his nose?
Yeah.
How it's, okay.
Wow.
We're like uncrooked. Is that a word, Kirk? Uncrooked.
Yes, I like that. Uncrooked.
It is now. It's straight now. It's a highly technical.
And you didn't re-break his nose to do
No,
that.
I did. Well, here's the thing. Because why are we attracted to beautiful faces, right? The symmetrical,
Because they can
beautiful-
breathe better.
Yes, and they have a body that functions, that they have a nervous system that functions, which what we focus is creating that so that you can breathe without effort. Yeah. That's the key there.
So you just the light bulb went on when you said we bend and break around trying to keep this cavity open. How do you know when you start off something like this? When you're doing the test that Mike went through and you're creating this device?
I'll look at their face. Honestly, your face is byproduct of your body. So what your body puts in your face, the world knows who you are, right? That's why people come to dentists the first thing in the morning when they age, like, oh my gosh, my mouth is just falling apart, gotta go to the dentist. Because if you can make this happen, that tells the world, I got a healthy body.
But that's esoteric and that's altruistic. Talk to me about why. How does a crooked face have anything to do with breathing better, or have to do with what's going on inside?
You're right. That sounds esoteric because we lost the sight of the fact that our body comes to life, like when we're born, all the way till we become adult until we die. It's constantly changing and responding. And what's here is the part of our body that just puts up that it's a manifestation of those changes. So when your mouth is falling apart, it's because your body is falling apart. People clench, grind their teeth at night is an attempt to breathe, right? So they're destroying their teeth. Oh yeah, absolutely. This has been already proven. Our body, the tongue, when tongue doesn't have room for breathing, when the airway is collapsing, and when brain is not getting oxygen, one of the first attempts is clenching and grinding. So when your teeth are getting destroyed, you really don't know the correlation is because of lack of breathing, body's alignment, and that twist that is in your body is all from that.
Dr. Esmaili, when you're seeing a patient now, just a dental patient, not a sleep apnea, but a dental patient, Are you to the point where you're realizing that a lot of the problems they're having is because they may have sleep apnea?
Oh, every single disease that I treated solely for the first 10 years of dentistry, every single disease in dentistry is related to the way we breathe. From cavities to microbiome, because think about it. When you're breathing through your mouth, all that environment, the pH of the mouth changes and you have cavities. You become prone to growing bacteria that is not supposed to. Now you're a host for certain bacteria. That starts the periodontal disease, which we see children that are mouth breathing. Only their front teeth have gum problems because the air hits it. So that moist environment is compromised because their nose isn't functioning, along with their facial changes, along with the position of their jaw and teeth. Everything falls apart. So yeah, everything I treated from dentistry, cavities, gum disease, broken teeth, was related to breathing, which is why I don't do dentistry anymore. I'm only focused on making people breathe.
And what's interesting to me, Kirk, is how did it become a dentist's job to sort of take this on, in your opinion? In terms of why, when you were, as a company, developing technology and such, why not physician? Why not ear, nose, and throat? Why dentist?
So remember what I said earlier about the journey that medicine has been on of discovery of what this disease is and what it does. And what we've realized is that a lot of things sort of there's a confluence of things that resolve in the oral cavity. So what's happened is that the dental industry has reluctantly been thrust into the limelight here to do something other than fillings and crowns and root canals.
Right.
And suddenly medicine is looking to them going, you know, all these things are resolving in the oral cavity. Maybe you guys in dentistry ought to think about how you can do something. And the dentists are going, well, we have this mandibular advancement device. That's been around for 40 years. It's just not a great solution. So Vivos has got the next generation of things which will actually get to the root cause of the problem. And I think that's the key point.
The science involved in this, obviously, is FDA
Cleared.
FDA cleared. You've got new insurance codes out there, which are huge, meaning that people can use their insurance to get this done. What's next, do you think, in terms of technology and in terms of breakthrough? Because it's all about adoption right now, right?
Yeah. So I think for us, it's all about execution on our. You know, we've talked here previously about how we've pivoted to a more medical-facing thing.
Sure.
The head of our clinical advisory board heads up the sleep center at Stanford University. We've got medical doctors now publishing and putting out statements about us. We'll have a medical doctor here on in the next segment here, right? But we're pivoting more towards medicine because medicine is where these patients are. They're not, they may be in the dental office, but the dentists are consumed by dentistry stuff.
Right, right.
So the next big thing for Vivos is to get the attention of the medical community to say, hey, there's another alternative to CPAP. Your patients want it. Your patients will use it instead of CPAP being in the corner or on the shelf. Yeah. And their patients will stay better longer.
Dr. Ismaili, last time you were on there, you talked to us about the untold truth about sleep apnea.
Yeah.
Review that again, because I think people, we hear about people dying in their sleep and so on and so forth.
Yeah, the untold truth is the obstructive sleep apnea is when we actually have patients wired with a sleep test to know that they can breathe. But the truth of it is they're not breathing the other two-thirds either. And it just really dawned on me talking to our guest at the next segment, he's a medical doctor, is our diagnosis diagnosis of this condition needs to be generalized. It's global. The treatment should be specialized. We're applying the specialization to diagnosis, which means you're focusing on the tooth, you're focusing on keeping the airway open with a CPAP, you're focusing on surgery. But the fact of the matter is, to keep that tube open, as Kirk was alluding, that airway has walls. There's multitude of specialties in multiple levels. When you can't breathe, your pH changes. That's physiology, your gut changes. Those are the things that need to be addressed, but you can do that by specialization of diagnostics.
Okay, so, and we're going to get to your doctor in a moment. Aman Singh is a board-certified sleep physician, correct? He can talk about it. Before we get to that, though, if I'm not mistaken, you got permission from one of your patients to come on with us via Zoom in the next segment. Talk about, before we talk to this patient, when you met this patient, and all patients, can you tell in the beginning what their outcome's going to be, or is it always a surprise to you? Or
no, not to me. Honestly, their journey sometimes is 10 years before they get to me, and within 3 months, they are like practically resolved. And that's the story I see every day. Well, the question is, why did it take him so long to get to the place? And do I have a magic tool? The question is no, I don't even have a magic tool. As a matter of fact, Our appliance is the Rolls Royce of all oral appliances, as Kirk was saying, because we change things from top down. But what we really do focus is the rest of the body, and we bring in the whole team together so we can put things in order. It's like fixing a car in a garage by yourself, or you have all the special people that know the car to fix it. That's a different story. Stephen has been dealing with the problem of not just the sleep apnea, but his entire breathing disorder. Forget this, 10 years. 10 years. I mean, $500,000 that he has recordly spent.
Okay,
right?
stand by, because we're going to talk to Stephen McKay. We have his permission, correct?
Yes.
To come on the air and
Hold
talk to
on.
us.
He's coming to us from England.
So, okay, so he's going to Zoom us from England. He's going to talk to us live here about his journey. And you'll be able to get a little, you could run out of the building screaming, or you could stay. Big Biz Show. Vivos Therapeutics, VVOS. We'll see you in a second.